efforts to strengthen St. Lucia's capacity to detect and respond to new and emerging drug trends is advancing following the recent Stakeholder seminar on the early warning system on drugs convened by the Substance Abuse Advisory Council Secretariat, SACS, within the Ministry of Health, Wellness and Elderly Affairs. The seminar brought together public health practitioners, representatives of secondary healthcare facilities, representatives from national security agencies, and representatives from government ministries. This seminar provided a platform for stakeholders to engage in dialogue, share experiences, and build capacity for the successful implementation of the early warning system in country. The early warning system was launched in October 2024 and serves as a surveillance system which will facilitate interagency communication and decision-making as it pertains to responding to the threats of new and emerging drugs. Coordinator of the Substance Abuse Advisory Council Secretariat, Natasha Lloyd-Felix, underscored the importance of the early warning system as it will assist in ensuring a proactive response to the potential threats of new psychoactive substances, NPS. New psychoactive substances are drugs that copy the effects of illegal substances like cannabis and cocaine.
By bringing the various agencies together, it would allow us to have a more agile response. The tendency has been for us to be more responsive to situations, but through an early warning system, which is multi-agency, multidisciplinary, we would be able to be more proactive and allow for our efforts to be more integrated. So the benefit of having this in place is that you would find our agencies are able to come together in a more synchronized manner, and we would be able to intervene, we would be able to communicate to the public in a more timely manner, and we would have a more proactive response to potential threats that would be posed to our public, our various populations who are at potential risk of using particular substances, particularly new and emerging psychoactive substances.
Inspector of the Customs and Excise Department, who is also a member of the Early Warning System Committee, Darren Solomon, called for stakeholders to fully support and appreciate this initiative, which will help St. Lucia to fight against the threats of new psychoactive substances, NPS.
This threat is real and it's already knocking on our doorsteps. These substances continue to evolve faster than our traditional control systems, posing serious risks to health, safety, and security. Our response, therefore, must be just as dynamic, built on coordination, information sharing, and early action.
Stakeholders also got the opportunity to hear the experiences of another Caribbean country, that is Barbados, using the early warning system EWS to effectively respond to evolving drug threats. Deputy Manager of the National Council on Substance Abuse and EWS Coordinator in Barbados, Troy Wickham, presented at the seminar and highlighted the importance of the early warning system for public health and safety.
It's important for persons to take in as much information as possible, share this information with their colleagues when they go back to their respective departments and formations. Also, that we can collaborate as a region, as a hemisphere, especially Caribbean region. We are so close to each other geographically, and I can say probably what's impacting Barbados may be impacting St. Lucia, and it's important for us to collaborate, and trust each other. We know that, especially with law enforcement, as treatment facilities, substance abuse, as drugs especially, are a bit taboo when people don't like to share information. But mechanisms such as the early warning system have been designed for persons to collaborate and to trust each other and share information so that it will impact the entire society in combating these substances.
The Stakeholder Seminar on Early Warning System for Drugs received technical support and funding from the Organization of American States through the Inter-American Drug Abuse Control Commission, OAS-CICAD, and the Government of Italy. The Substance Abuse Advisory Council Secretariat, through its Early Warning System Committee, is committed to ensuring continued collaboration among stakeholders and to utilize the various strategies or protocols for control of new and emerging psychoactive substances. Reporting from the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Fernal Neptune.